PT Society. Today we have our awesome presenter, Nicole Cesca here, and she's going to tell you a bit about her physio journey and answer some of your questions you might have. So Nicole, I'll hand it over to you.
Thank you very much. All right, so like Simona said, my name is Nicole, and so today I'll just be going over a little bit about myself, my journey to PT school, what it's like being a current PT student, and then at the end I'll open it up to any questions you guys may have. So to start off, just a little bit about me. I graduated from the University of Windsor in 2020. I completed a Bachelor of Science in Biochemistry. Now, in physio school, I would say that definitely the majority of students either have a kin or some sort of health science background. However, you will find that some students are from other areas as well, such as even music and business. So I'm currently a second year PT student at the University of Toronto, and I will graduate in 2022. And so some of my hobbies and interests include hiking, cycling, and golfing. I'm also very passionate about nutrition and love exploring with new recipes, and I love watching hockey, and my favorite team is the Toronto Maple Leafs. So my passion for physiotherapy. So it started off with my love for anatomy, health, and wellness. I was always very fascinated by the human body, how it moves, and really how certain exercises allow the body to heal itself. And through volunteering and becoming more familiar with the field of physiotherapy and what a physiotherapist actually does, I also became very interested in manual therapy. And I knew that I wanted to pursue a career in physiotherapy when I saw firsthand how much physiotherapy could increase the quality of one's life. I struggled with shin splints for several years as a distance runner in high school and a little bit in university. And I really saw the benefits of physiotherapy, and it kind of really sparked my interest in the area. So my experiences at the University of Windsor. So I was involved with an organization called SOS. And if you're not already familiar with SOS, it is an organization which hosts exam aid sessions to raise money for education systems in Latin America. And on SOS, I played two major roles. I was an exam aid tutor for inorganic chemistry, as well as I was the media exec. So as a tutor, I would host exam aid sessions before midterm and final exams, and it would help students better understand course material, and I would help to give them tips on how to tackle midterm and final exams. I also had the opportunity of being a human anatomy TA for 2 years. And I know in the kinesiology program, there's a specific human anatomy, but there's also one in the science program. So I was the TA for the one in sciences. And in this position, I worked with other graduate students in the field of biology, and I ran lab sessions, helped with dissections. I helped students understand the lab material, and I also helped mark assignments. I also had the opportunity of completing an undergraduate thesis with Dr. Drew Markhart in the lab for advanced biomembrane research. And I was exposed in this position to how scientific research is conducted. I also learned how to create a thesis presentation, and I also got the opportunity to improve my scientific writing skills. And lastly, I was part of the varsity women's golf team, where I got to meet and train with many of the exceptional athletes in the Windsor area. So what I learned from these experiences and how these experiences help to enrich my physio application. So as a media exec, I took on a leadership role and learned how to communicate with others on my exec team, which is important skill as a PT, because you'll be working with many other healthcare professionals and you'll need to be able to communicate with others. As a tutor, I learned how to educate and explain concepts to others. And now this is a very important skill to have as a PT because patient education is a large part of the physiotherapy profession. Typically, when a patient comes to you with a certain condition, you'll want to explain the condition to them in patient-friendly language, so not any like scary science terms. So from tutoring, I learned how to take a complex topic and explain it in simple terms. And as a human anatomy TA, I got the opportunity to enrich my human anatomy knowledge, which was great because the more you know and the more you know about the anatomy of the human body, it will just help to inform your PT interventions. It'll help make your treatment plans more applicable to the conditions that you're trying to treat. I also, from this, learned how to take complex topics and explain them more simply, which is something a physiotherapist will do, and it's a major role of a physiotherapist. Now, completing an undergraduate thesis helped me to become more familiar with research and the research process, and specifically how to critically appraise literature. And in PT school, there is a research curriculum. I believe at the University of Toronto, there's a big emphasis on research. I believe at all the other universities in Ontario, they do have a research curriculum as well. And because PTs have a role as a scholarly practitioner, it's important to be able to effectively appraise the literature, so be able to read it and understand what you're reading. And this way you can incorporate evidence into your practice, because when you're treating others, you want to be able to understand what the literature says and be able to apply it to a real life patient scenario. And also, as a member of the varsity golf team, I learned time management skills, which are important for physio school. As in physio school, you'll be balancing your school life, your social life, and anything else you want to be involved in, as well as it extends even beyond physio school. And as a PT, time management is important in anything you do. So now I will get into some of my physio and healthcare related volunteer experiences while I completed my undergrad. So specifically my physio related experiences. So a major part of my physio related experiences was I volunteered at a private practice clinic in Windsor for over 2 years while I completed my undergrad. And during this experience, I volunteered as a physio assistant. So I just helped around the clinic with ultrasound, different modalities. I got to sit in on a few assessments and watched what a PT actually did. So from this experience, I learned more about the PT profession, the different areas of physiotherapy, such as cardio, neuro, and ortho. I got to volunteer with a really exceptional PT who exposed me to all these different areas and taught me a little bit about the different areas of physio, which I think is really important and something I'll mention later on in my presentation. I also got to learn how to work with other PTs and PTAs, which is also important because sometimes in private practice specifically, you're not always by yourself. You'll be with other PTs and PTAs, but also in a hospital setting or in a rehab setting, you'll be with other healthcare professionals such as OTs, doctors, nurses, social workers, SLPs. So it's important to learn how to work well with other healthcare professionals. I also got the opportunity to learn about exercise prescription, different modalities, the basics of physiotherapy, and how a typical assessment is performed. And I think that volunteering in this type of setting was really a great first step to learn how to communicate and develop a rapport with patients. And this is important in PT because you want your patients to feel comfortable and to be able to trust you. So it was a really great first step to learn how to talk to patients and to really gain a patient's trust, which is really important when you're a physiotherapist. So some other volunteer experiences I had or did in my undergrad is I volunteered with other healthcare professionals. I volunteered with some chiropractors, an optometrist, and some nutritionists. And in these experiences, I learned about other professions in the healthcare field. I learned how to work with a whole interprofessional team, which is important because depending on your setting that you work in, like I mentioned before, you may work with other healthcare professionals. Also, in school, there is something called IPE, and I believe it's in all the programs in Ontario, and you get the opportunity to interact with other healthcare professional students. So you get the opportunity to interact with doctors, like students, so MD students, OT students, SLP students, other rehab students, nursing students, and just collaborate and kind of figure out what everyone does and what their role is on the healthcare team and how you can work together cohesively and really make the healthcare system in Canada the best it can be. So it's really interesting to be able to see what other healthcare professionals do. And different volunteer experiences can be valuable as they can also teach you different skills that are transferable to the PT profession. So my advice would just be to get involved. Physio-related experience can help you become more familiar with the PT profession and the scope of practice. I know some people who volunteer just at one physiotherapy clinic for all of their undergrad and gained so much experience, learned how to develop a rapport with patients, and they had a very strong application. And I know others who had experience in a variety of different settings, and that also makes your application really strong because you get to see all the different areas of physio. So what I would say is just get involved and do, if you're interested in many areas, I would say try to volunteer in as many areas as you can. If there's a specific area that you're really interested in and you're enjoying volunteering in that area, then try to create a rapport with patients, talk to the physio that you're volunteering with, and see if there's anything else you can do to help your learning in that area. Um, in addition, though, to physio-related experiences, many strong applicants will also have several other non-related physio experiences. And when you work with others and get involved, you learn many transferable skills such as communication, time management, critical thinking, and much, much more. And it just helps to make you a stronger and more well-rounded applicant. So now let's dive into a little bit of a life as a PT student. So I'll talk to you a little bit about courses, schedule, and my experiences will be more specific to the University of Toronto. However, schedule, workload looks similar no matter which physio school you attend in Ontario. They all pretty much go over the same topics. It's just outlined a little bit differently, and they all have their own little twists to how they like to outline things and deliver material. So schedule. So a typical schedule as a student is 9 a.m. to 4 or 5 p.m. and we're in school Monday to Friday. Our typical day will consist of lectures, anatomy labs, hands-on clinical skill labs, which is where we really learn all of our physiotherapy interventions and how to apply skills we learn in lectures and clinical labs, so on our colleagues, which is a really cool experience. We also do a lot of group projects, group discussions, a lot. I'm not sure exactly how Kin is, but I feel like maybe there are more group projects, maybe group work, but there's definitely a lot of group work in physio school. So you get to meet your colleagues, learn how to work with them. So it's really interesting and you make great connections, which you can hopefully hold on to for your whole career. And there's a lot of interprofessional learning, which I just talked about before, where you meet with other students from other healthcare professions and you get to see exactly what they're learning in school and how you can work together and make our healthcare system better. And what everyone loves is clinical placements, and that's something I will get into and talk about later, but that makes a big part of the PT program. So topics. So the major topics that PT school covers is musculoskeletal PT. So this is like orthopedics, probably the most popular and most likely what most people are familiar with, and a lot of musculoskeletal PTs or orthopedic PTs practice in private practices. Also, there's cardiorespiratory PT, and a lot of these PTs practice in like acute care settings in the hospital, as well as we learn about neurological PT, and a lot of these physios either practice in private practice, also in like major rehab centers, and a little bit in the hospital as well. There are many special topics that continue on throughout the PT program, especially at the University of Toronto. And we go over pediatrics, vestibular rehab, amputees, burns, pelvic health, wound care, pain sciences. We learn about the business of physiotherapy, a little bit of research. We do conduct a research protocol, and we do a final presentation at the end of the year, as well as we learn about ethics, medical ethics, and healthcare ethics, and so much more. There's a lot of special topics that we kind of get into, a little bit of sports rehab, as well as like a leadership role as a physiotherapist. So now I'll move on to clinical placements. And clinical placements is really the time where you get to put what you learn in school into practice. And this is the opportunity where you get to take your skills you learned in lab and apply them to real patients. And it's also a chance for you to gain clinical experience in a variety of physiotherapy settings, which you may not have ever been exposed to. So I'll briefly go over my clinical experiences thus far so you can have an idea of what you could expect out on placement. Right now, I'm currently on my third clinical placement out of a total of 5. And some of the most valuable lessons I would say that I have learned so far are just to keep an open mind. You never know which area of PT you may have not thought you would like, but you may be pleasantly surprised that you've actually come to like that area. So it's just important to always keep an open mind and learn as much as you can. Listen to patients, other healthcare professionals, your clinical instructors, and practice communicating with others. And this is just a very important skill to have as a PT, so you can really never get too much practice. As well as listening and communicating with others will also help to enhance your knowledge in the field. And just most importantly, just enjoy the experience and have fun. Being out in clinical placement is so amazing. So many PTs are so helpful. They really want you to succeed. I would say like being in the clinical environment is one of my favorite parts of PT school. Just working with other professionals in the field is just a really great experience. A lot of them are very knowledgeable, and they're really, really helpful and so kind and just really want you to succeed. So it's really just a great experience overall. So I'll go over my first placement so you can see kind of the areas I've been exposed to so far. So my first clinical placement was a combined research and outpatient orthopedic internship, and I conducted research relating to pressure injuries, and I learned a little bit more about pressure injury prevention and management. And so if you don't know what a pressure injury is, a pressure injury is essentially a sore on your skin, and it forms in areas which are exposed to a high level of pressure for long periods of time. So if you're wheelchair bound and sitting in a wheelchair all day, your IT, so your ischial tuberosity or your sit bones, will be under a lot of pressure, and over that bony prominence there, you can develop a pressure injury or a sore. And I also was able to work with patients with a variety of musculoskeletal injuries when I was in the outpatient orthopedics portion of this internship, and I worked with patients with sprains, strains, and tendinopathies. And one thing that was really interesting about this placement is that I got to learn some new modalities which I've never been exposed to before, such as shockwave therapy, which I've come to find out that a lot of people really like shockwave therapy. So it was really cool to be able to use that modality. My second internship was an outpatient orthopedic internship in a private practice in the Toronto area. it was a very fast-paced environment. Typically, we saw anywhere from 20 to 25 patients a day. And in this internship, I treated patients with a variety of conditions. We usually saw patients with soft tissue injuries, patients who suffered motor vehicle accidents, patients with whiplash, patients with concussions, and I even got to do a little bit of vestibular rehab, which was really interesting and something that I will learn more about in my second year of the physiotherapy program at the University of Toronto. And so finally, the placement I'm currently at right now is I'm working as an inpatient PT student and I'm treating patients specifically living with spinal cord injuries. So I will see patients with both incomplete spinal cord injuries and complete spinal cord injuries. And if you're wondering about the difference between the two, complete spinal cord injuries, these patients will have no sensory or motor function below their level of injury. And incomplete spinal cord injuries, they'll either have sensory or both motor function and sensory function below their level of injury. So some of the things we'll do with these types of patients is incomplete patients who have high level of motor function will typically be able to walk with them. So we'll get them walking in parallel bars. We'll do gait retraining with them. We'll teach them how to sit at the edge of the bed and how to stand again. We'll also get to use, in this setting, you also get to use a lot of equipment such as body weight support treadmill training. I don't know if any of you have ever seen that, but it's really cool. It's where you're hooked up and you kind of are able to off weight some of your weight and they'll walk on a treadmill. And as a PT, you'll help facilitate and place their limbs in the proper position to help them walk again. And what the treadmill does is just off weight some of their body weight so that they're not fully weight bearing on all of their limbs, so it's easier for them to walk. So that's really cool to be able to see. And so as a PT student and a future PT, some of the things I look forward to. So I look forward to sharing my passion for health and wellness, taking an individualized approach to treatment in order to improve the quality of life of others, continuing to enhance my skills in the area of physiotherapy, and just continuing to learn every day from others in the field. There are so many knowledgeable PTs out there in Canada and in the world, and it's just really great to be able to get to learn from all of them. So thank you so much for listening, and if you have any questions, I would love to answer them.
Thank you, Nicole, for your presentation. That was super informative, and it was nice hearing about all the different places you've been and your experiences, and getting a better feel for what it's like being in PT school. So that was very helpful. So thank you again for joining us.
Yeah, no problem. If anyone has any questions about anything, about applications to PT school or anything about PT school or anything about my experience at Windsor, feel free to ask.
I have a question. So what are your top tips for the CAP? And can you talk to us a bit about that?
Sure. So the CAP, so when I applied to physio school, it was right when COVID started. So the CAP was administered. The CAP's always administered online, but I believe in the past you would actually have to go to Toronto and write it. But I think because of COVID, and it's probably going to be the same now, you can write it from home. But the CAP is sort of like, I would say, another Casper, but kind of more specific to what maybe the University of Toronto is looking for. So I would say to prepare for it, prepare like you're doing a interview. So go over your strengths, weaknesses as well, but usually they don't ask about that because it's kind of like it's a little bit of an awkward question to ask, but just kind of like some of your strengths and what your physio experience is to date. So kind of have that at the top of your head so you can easily pull from experiences and how different experiences you've had relate to physio and why they would make you a good PT. So, for example, if you, well, for any of you who are in this PT society at the University of Windsor, some of the things that you've learned organizing all of these events you're doing, you can talk about some of your experiences doing that and how you had to communicate with one another. And then I would relate everything back to being a physio because it really shows that you're able to take skills and relate them back to the physiotherapy profession. So I think that's something definitely they look for, as well as they any experiences that you have that relate to physio. I would kind of write them down, jot them down before you write the cap, just to have those at the top of your mind because they do ask for like physio experiences and why you enjoyed these experiences and how these experiences will help to shape you to be a good physiotherapist. Um, some other questions they asked, like some like situational, if I remember correctly, some situational based questions, kind of a little bit like the Casper, just to see how you would handle certain situations. Um, they also, it kind of just to test your creativity as well. So how you're able to read a question and kind of respond to it in almost like a creative way, but kind of like relating everything back to physio and how and why you're just really a good applicant for or good applicant and why you would make a good physiotherapist. So to prepare, I would prepare how I prepared is I looked at questions online. There's a lot of questions online that kind of outline the cap a little bit, or even the Casper. A lot of those questions help write out all your strengths, all your experiences to date. Um, I think as well, if I'm not mistaken, they do send out some practice questions, or there's some practice questions that you can access online. They're very different than what's asked on the CAT, but they do help to kind of get you in that mindset of thinking. Another thing that I've told others who have asked about this is just familiarize yourself with the other areas of physio. If you know about cardio, neuro, ortho, they really like to see that you kind of are like well-rounded and you're not just like set on a specific area. You're open to exploring the many different areas. And the more you know about the physiotherapy profession, the better applicant you'll be, just because they'll see that you have a rich understanding of what physio is. As well as for the CAP specifically, because it applies to Toronto, I did a little bit of research on like the pillars, like Toronto's pillars and what they stood for, and like their professionalism and they like critical thinking. So kind of just like relating everything I wrote kind of back to like their pillars and how this experience I had improved my critical thinking and my professionalism, because that's something that the University of Toronto really looked for, if that makes sense.
Yeah, for sure. That was very helpful. Any other questions here? I know I have a lot, so I'll hold off before people ask.
I think Sarah might have a question.
Yeah, yeah. You could either post it in chat or unmute yourself, Sarah, up to you.
Oh, I don't think she can unmute.
Okay, maybe while she's typing, I have a question. I'm just curious, did you apply to many other schools? And if you did, like which ones did you get into and kind of why did you pick Toronto?
Sure, yeah, that's a really good question. So I did, I applied to all the physio schools in Ontario, and I would recommend doing so just because a lot of the schools look for different applicants. And I got into two of the schools in Ontario, and I was waitlisted at the other two I applied to. And I would say that each school has something different they look for. I don't know exactly what it is, but that's why I would say apply to all of them because you never know which ones you'll get into. And I think that's the advice from like everyone I've talked to. Also, I know a lot of people who have been waitlisted at schools and have gotten in off the wait list. So that's really positive. So that's good. But why I specifically chose the University of Toronto was the University of Toronto was my first choice kind of going in. I know like everyone kind of has like choices going in, but all the schools in Ontario are really great schools, and like you'll get a great PT education no matter which school you go to, even in Canada. I know there's a different application process though for like schools in BC and Alberta. But I chose the University of Toronto just because of the placement opportunities here and as well as the research program. I knew they had a strong research program and I was kind of like interested in that a little bit, as well as Toronto just has so many placement opportunities to work with different populations. Like there's a lot of neuro rehab facilities in Toronto. There's a lot of opportunities for pediatric placements. There's a lot of opportunities in the hospitals for cardio placements, even like post total knee and hip replacements. There's a lot of areas of that. So there's just a rich and vast variety of placements here. So that's kind of one of the main things that drew me to Toronto, as well as when I wrote the CAP. The director and the head of the program was just so welcoming and just really created like a fun and safe space for everyone. So I thought she was very pleasant and I really enjoyed her presence. So I was like, oh, this will be, I think will be a good school to go to. And just now, like being at the University of Toronto, the faculty is just amazing. Like everyone wants you to succeed. They're very receptive to feedback and they're very helpful in like every way. So hopefully that answered your question.
Yeah, thank you so much.
Yeah, no problem.
Okay, Sarah, you might be able to unmute it now. You can give it a try. If not, maybe if you exit the meeting and try joining again. I'm not sure why it's not working. Oh, that's interesting. Okay, I see it. Yeah, it's allowing Maddie and Nate to join, but okay. She rejoined. Okay, let's try this.
Oh, it's working now.
Awesome.
So my question, so I understand that the volume of material in physio school is quite a lot, and I was wondering what your study process looked like. I know this will vary from class to class, but just in general, what that looks like.
For sure. So definitely first year I would say is very material heavy, especially so every school is different in how they deliver the material and when they deliver the material, but at Toronto, it's the first year is basically when you learn the majority of your content, and then second year it's a lot more clinical internships and as well as just the one unit of orthopedics. So in orthopedics, there's 2 units. It's kind of like an introduction to like assessment and treatment. And then we have like our advanced orthopedics, and that's in second year. So in first year, I would say definitely it's a little bit overwhelming at first, just with everything you're learning and the workload and just being in school. Some students, depending on how your undergrad schedule worked out, some students weren't used to being in school all day from like 9 to 4. So that was an adjustment for some students. And then coming home and reviewing material and preparing for lab on a daily. I would say that it depends on the person for sure. Most people don't do, I would say that a lot of people do something every day while they're in like the hard units. Some people don't. preparing, you don't always have studying to do, but sometimes just preparing for lab you have to do for the next day. And now this depends on the person. Some people go into lab and they don't prepare at all and they are totally fine. And some people prepare for lab and they want to know exactly what's going on and have a better understanding of what they're going to be doing that day. And so I would say that for the most part, I think the advice they give us is like I would say the typical person spends like 3 to 4 hours a day just like going over what just reviewing notes, going over what they want to do for the next day. Now, this varies when you have exams and practical exams. I mean, studying time, you guys know, you guys are writing midterms and finals. Studying time can just take up like your whole day, depending on where you are in the unit. But there is also, like now, I would say in placement, I don't spend much time outside of the clinical environment, like studying. I would say just like depending on the placement, I would just like prep for some patients if I need to. But you have a lot of downtime when you're not in the clinical environment, so you really get to enjoy like the company of your colleagues and kind of enjoy your weekends a little bit more than when you're in school. I would say your weekends in school, you're studying a little bit more, but you do have some off time where you get to kind of enjoy where you are if you do move to a different city and kind of explore the city a little bit more as well. Does that help to answer your question, Sarah?
Yes, it does. Thank you.
No problem.
Okay, another question I have is if you were back, like 2 years ago or less than 2 years ago, and you're applying again to PT schools, what would be the biggest advice you'd give for yourself on the applications, on the personal statement, or anything like that, or even the interview? Something you wish you did, or something you did well that you'd like to talk about.
For sure. So something for sure I wish I would have had more experiences in different areas of physio. I think coming from Windsor, and I don't know if this is just Windsor, and maybe you guys have different experiences, but I wasn't very exposed to other areas of physio. Like I was only very much exposed to orthopedics. I knew about cardio, I knew about neuro, but I didn't have a strong understanding of those areas. And those develop as you're in school, but I wish I just kind of would have had a little bit of a better understanding of those areas because I think they do make you a stronger applicant. And I think students coming from other schools kind of are a little bit exposed to those areas a little bit more. I mean, I don't know for sure, but just kind of hearing everyone in my program and talking to them, some of them have a little bit of a better understanding of neuro and cardio, like coming in to school. But for the most part, I would say like most people, the majority of people know just about orthopedics. So I would say kind of like familiarizing myself and like volunteering in different areas of physio to really like get a grasp of the profession. So like volunteering in a hospital, maybe at a rehab center with different populations of people. I think that makes you an excellent applicant, especially a lot of schools. Toronto doesn't look at experiences as much because I don't believe you have to write a personal statement for Toronto, but Queens and Western, they do look at a lot of experiences, so it helps to make you a stronger applicant in for those two schools for sure. Something else is just, I would say just be confident in yourself, really. Like you've come so far, you've worked so hard. Like if you're applying, like you're a good applicant, believe in yourself, like you can do it and just put your best effort forward. And even if it doesn't happen this year, if you want to be a physio, apply again next year. Like timelines don't matter. You're now starting your journey to being a physiotherapist. If this is something you want to do, if you take a year off, 2 years off, do a master's, and then go to physio school, it really doesn't matter. Like it doesn't make you any less of a better PT no matter when you start school. You'll come out with the same great experiences that you would have gained no matter when you started school. So just don't be discouraged and just be confident in yourself. And I guess one other piece of advice is I would say just like prepare for your interviews as if you would prepare for any interview you would do for like a job. Just know yourself well, know your strengths, what experiences you had, be able to recall anything you think they might ask, and that really highlights who you are. Like when you're in these situations, you want to, something I think I struggled with a little bit was kind of um like highlighting myself. Like you want to, like this is the time for you to say what you do well and why you'll be a good applicant. So I think a lot of people too tend to struggle a little bit because they feel like they don't want to, I don't know, like over promote themselves. I don't know, but this is the time to do so. Like that's exactly what you want to do, and you want to relate every experience um, to why you would be a good physio applicant.
Thank you so much for that. That's very helpful as well.
Yeah, no problem.
Okay. Any other questions here? Okay, no questions here. I have another question. How is adjusting to city life after being in Windsor for so long? How has that changed, and maybe how it, how it was different going to school in a bigger city as opposed, driving 10 minutes and getting to the university, or,
Yeah,
yeah.
for sure. So I would say, so when I started, I was in the midst of COVID, so no one was in the city at all. I was going to, I would honestly, I think we were the only program actually going in person. So we were very fortunate actually to be able to go in person like 3 times a week. All of our lectures were online, but our labs, our clinical skill labs and our anatomy labs were in person. So I think at the beginning, adjusting wasn't too bad. It wasn't very busy around. I live downtown, very close to everything. I walked. So that was weird because I was used to driving everywhere. So walking was definitely a change. But now in my second year, now that everything's opening up, definitely downtown is more busy. The city life is a lot more busy. There's a lot more hustle and bustle. So adjusting, I mean, I don't mind it. It's okay. Adjusting wasn't too bad. I think I was eased into it nicely. So I think that was very helpful. But definitely it can be challenging if you're not used to living away from home and you're not used to the big city life and honestly walking everywhere. Or some people do have a car and driving, but there's a lot of traffic in Toronto. But my experiences so far have been great. I love living in Toronto, so it's been really great.
And do a lot of the students end up renting places together or living together? Or?
Yeah, that's a good question. So a lot of the students do. They end up renting places together or living together, becoming roommates. A lot of great connections are made that way. So there's always, no matter where you go in Ontario, there's always like Facebook groups that get started once the acceptances come out and people are chatting, you get to know people, then you might find people you want to room with. And then that can change too in second year, but definitely people room together.
Yeah, that's good to know, especially with Toronto prices right now,
Yeah. Yeah.
definitely good to know. And
Yeah.
it fosters, better friendships, and
Exactly. Yeah.
that's part of the experience as well,
True.
right?
Exactly. And definitely there's a lot with, I think the University of Toronto did a really great job trying to get us engaged as much as possible, even through COVID. Like we had a lot of online events and a lot of kind of like meet and greets as much as we could. I mean, towards the end there, everyone was starting to get a little bit tired with like all the online events, but I think we did the best we could trying to get to meet everyone, so that was good. But now that everything's opening up, there's a lot more activities like intramurals are now a thing. So I would say like when you're in physio school, just get involved, get to meet people. It's about meeting people as well because these are your colleagues for life. You never know when you'll run into them again, or you might work with them. You know, you'll always have their number. You might run into a patient one day and you might be stuck and you might have a question for one of them and ask them advice on something. So you're really creating like lifelong friendships in physio school for sure. And that's part of the experience as well.
For sure. Yeah, that's good to hear, especially being in COVID for so long.
Yeah,
It's
exactly.
nice to have some person connection, seeing people and
Exactly.
interacting with them.
Yeah.
But yeah, any other questions at all for Nicole before we end the meeting?
If any of your group has any other questions, you can feel free to email me and I'll respond, no problem. If you have any questions about application processes as people are doing those or anything in general.
For sure. If you want, you could put your email in the chat, or I could just let them know if they have any questions. Or...
Yeah, whatever's easier. Do you want to let them know, or would you rather me put my email in the chat?
Whatever you'd prefer. I'm okay with either.
I can throw my email in the chat, but you can let them know as well if
Sure.
Whatever. Throw that.
Okay, awesome. Thank you very much.
Yeah, no problem.
I think that's a wrap for today. So thank you everyone for joining. Hope you learned a lot. And thank you again, Nicole, for joining us and answering our questions and making the presentation. It was awesome.
Thanks for having me, and good luck to all of you. If you're thinking about starting a physiotherapy journey, it's a really great and rewarding profession. So I wish you all the best of luck, and hopefully I see you guys one day in the field.
Thank you, Nicole. All
Yes, I
right.
hope so too. Thank you so
Yeah.
much.
Yeah, no problem.
Have a good one.
Have a great day.
Bye, everyone.